Hi, I'm Dr. Jess Roth, and I'm here with Sarah. And Sarah, why don't you introduce yourself and your modality and what you specialize in?
Yeah, well, my name's Sarah, just like Jess said.
Mhm.
I am a massage therapist, and more specifically, I guess that I would say that I practice therapeutic massage. Um, so that's a little bit different than run-of-the-mill little spa relaxation situation, which that has its place, but yeah.
100%. Do when you say therapeutic, do you mean like more of that deep tissue type of thing, or do you mean like lymphatic drainage? Like, what do you mean by therapeutic?
So, by therapeutic massage, I guess I mean that there is that it's result driven. So, not necessarily that you're coming in just for relaxation, even though that ends up being a result of what we do. But yeah, so I practice like neuromuscular therapy is probably the biggest one. Clinical massage, which I feel is like probably commonly referred to as that deep tissue massage. That lymphatic circulation happens with a lot of massage, but I am trained in like lymph drainage massage. Um, Also trained in prenatal massage, of course, which, good.
Yeah.
And then I also do like guasha, Chinese fire cupping, foot reflexology, just the things,
All the modalities. I
all
love
the
it.
modalities.
I love it because like
Yeah.
you use the cupping, the Graston for certain patients, different scenarios type of thing. Do you ever use like all those modalities kind of combined with your treatments as well?
Combined, like infused into a treatment, or do
Like
I do them all
using
standalone?
Graston and cupping, or sorry, not Graston, guasha and cupping and lymph drainage all in like one, or is it like separate services that people have to book?
Oh no, it's sometimes it just kind of unfolds before us when we're in a session, you know what I mean? Uh Sometimes we don't know exactly what somebody needs when they come in. So you come in and you book an hour massage, or you book an
Mhm.
hour massage with cupping, and we do like craniosacral. We also do neuromuscular. I'm going to scrape you a little bit with some guasha, and then, toss a little cup action on at the end. So,
See how it goes.
um I hope that answers the question.
Oh,
So yeah, it's
100%.
all, what I will say is no two sessions are the same, even for the same person. There's no, I do not have a routine.
Perfect.
You know what I mean? So
I love
yeah.
it. I love it. When it comes to pregnancy, because you said you specialize in prenatal massage as well,
Mhm.
how do you typically go working through them through their trimesters? Do you have them face down? Do you have them on their side? Do you have them, how does that work with pregnancy?
Until we start like kind of getting out there with the belly, a lot of women are like super comfortable going face down. And I do have a little bit of extra padding on my table just to like accommodate for anything that might be, sticking out a little bit. Um, but other than that, I don't do face down bolstering into late trimesters. So I will do most of that side lying, and then you can also be laying on your back for pretty much, for a lot of people, through the whole thing. Not for an extended period of time. We, bolster you up on your right hip, and you're kind of lean in, whatever. We really gracefully place a lot of pillows so that you're nice and comfy, and so that the treatment's effective.
Awesome. Is there
Yeah.
any modalities that you avoid doing while pregnant? Like, are you going to be like, do you do cupping on like the lower back and glutes and everything like that? Is there anything like that type of thing that you have to avoid or not really?
Um, I would say some folks don't avoid it. I don't actively encourage us to do that because I find that there's things that like the manual therapy I feel is more effective. Like doing the NMT, doing like, you know, the craniosacral, and like doing that passive and active range of motion. I have felt in the past has been more helpful. But yes, there are like areas of the body that we would avoid. Like
Right.
there's specific points right up here in your traps. There's little points in your feet, but if someone's coming in and telling me that they have low back pain, I do target pelvic ligaments to help alleviate that, because a lot of times that, that or that kind of like anterior pelvic tilt might be where it's coming from. I mean, you guys are the experts.
Yeah,
You know?
absolutely.
Yeah.
No, absolutely. So that's where like chiropractic and massage like work hand in hand together is like we address like the structural type of things and then massage refer out to massage therapists for all the muscular things and
We
it just
support
like
each other, baby. We support each other.
100%. Is so when you do craniosacral therapy, do you see breech babies and like when women come in and they specifically ask for cranial work done because that is beneficial with like relaxing the body in order for like babe to have more room to flip? I've heard of like a lot of midwives doing that type of thing. Do you
Mhm.
do that as well?
I think that that's not an active intention that I have within doing craniosacral for pregnant women, but I do have some friends and some connections that do have those intentions, and that is like a very specific thing that they practice. Although that might become a result of something that I do, mine is more the way that I practice is a little more focused on like ensuring that like all these systems are communicating effectively with each other to make this big miracle happen. So yeah,
Absolutely. Cool.
yeah.
Awesome. Is there any like therapies or injuries out there that you just absolutely love working on?
Like just generally, not
Yeah.
speaking about.
Not
So
not specific for pregnancy, or you could relate it to pregnancy. It does not matter. But like knee pain, ankle pain, anything like that type of thing.
oh yeah, head, neck, shoulder. That's I mean, I love it all.
Yeah.
I like putting all the puzzles together. That's very fun for me. But I mean, even though I'm sad that you're in pain, but but my job is fun for me. So I would say, yeah, head, neck, shoulder. There's a lot of people that go through life with like no relief from like their headaches, from like stiff neck pains, from, just like generally not being released in like the front of the body, the pecs and anterior neck. And that can kind of wreak some havoc on those scenarios. So yeah,
Absolutely. Do you go into the jaw as well?
big time.
Big time.
Yeah.
Cool.
Uh-huh.
That's awesome. We
Yeah.
we love a good jaw work on in our side.
Oh yeah. I
Everybody
actually
needs the
just,
jaw.
yeah, you guys do it as well?
Well, everybody just needs the jaw work. I just
Yeah.
love it so much.
I know it's important. And I did just listen to, I feel like I looked up on YouTube, looked up your guys' channel,
Mhm.
and I saw that you guys had, I'm not gonna remember what her job was, but she was like a tongue tie expert.
Oh, yeah. Was it another provider within the
Yeah.
clinic?
No, you had interviewed her.
Oh, yeah, yeah. Dr. Lervick or Dr. Geisler.
Okay.
Yeah.
I don't know the answer, but yes,
Okay.
one of them was like all about mouth and tongue action and like, you know what
Yeah,
I mean? And I was like, yeah, cool.
absolutely. Those two are like number one pediatric dentists that we refer to,
Mhm.
just because they're the best. And
Yeah.
so, yeah, they are the ones that do the revisions. And then we typically work with the infants to prep their bodies before they get the
Mhm.
revisions and then the post revision as well. And
Yeah.
so we don't necessarily do like cranial work on adults unless requested,
Yeah.
but on infants and like little ones, that's where we like do a lot of the cranial work type of thing, just to help
Cool.
relax their body, get them all set up for that process type of thing.
Love. Yeah.
Yeah,
Good.
I love it. Okay.
Cool.
How do people typically book through you?
Yeah. How do they book? Typically, they will book like online on my website, which is wellwithEvergreen.com. And they could be finding that organically just from searching me online, or not searching me, but like searching, let's say that they looked up like massage for TMJ dysfunction or like massage for headaches, or massage for pregnancy. So, um, so yeah, booking online is great. And I would say that that's like 90% of the time, but the other 10% is typically when somebody's already in here and I'm just rebooking them for their next session in person.
Yeah. And
Yeah,
every case is like different, right? When you want them to come back type of thing, or do you
generally.
typically recommend do you recommend like maintenance massages and stuff like that type of thing just to keep their bodies good or
Yeah, I mean, I kind of put the ball in your court, in that arena. I don't want to tell you that, you should be coming in every 4 weeks for the rest of your life if that's like not something that you actually need. But of course, if it's something that you want and you like having it incorporated into your like health routine
Mhm.
and, your health span slash longevity routine, then I think that that's great. Like there's people that I see weekly because they like it and they find benefit in it. There's people that I see monthly. There's people that I like to see every 2 weeks. You know what I mean?
Yep.
So, or sometimes it's like if there's a specific issue like frozen shoulder,
Mhm.
we'll see you every 2 weeks for, for however long,
Yep.
typically if that condition specifically would take I don't know, maybe a couple of months,
Yep.
2, 3 months, something like that.
That
But
makes
yeah,
sense.
yeah.
Okay. Cool. And what is like, can you explain a little bit more about the cupping style you use? Because there's many different cupping styles out there, like plastic, silicone, glass. What kind of cupping do you do in your clinic?
Pure glass. So it's all the traditional Chinese fire cupping. I find that personally just number one on the end for me, maybe it's a little bit like selfish because it's like the easiest to sanitize
Okay.
and like keep
Yep.
clean.
Yep.
but
100%.
but also, it's pretty cool just having an open flame in the room,
Yeah.
rock and roll. But I find it to be effective because you're getting that suction like right when that cup is hitting the skin, and it doesn't necessarily give you a ton of doesn't not you but like your body and nervous
Yep.
system a ton of reaction time to be like, oh, do I like that, do I not like that? Too late, your fascia and your skin's already sucked up.
Yeah,
So
you're already good.
yeah, that's why I
Cool.
like it. But
Okay. Do you
yeah,
glide it as well?
yeah, I will slide, I can do pop cupping. Yeah,
All the above. I love it.
all the above, baby. Yeah.
Amazing.
Mm-hmm.
And then with guasha too, do you ever find that like sometimes leaves marks or anything like that type of
Oh yeah.
thing? Or like, is there any areas on the body where you really like doing guasha and how it's like super effective, like on the IT band or like anything like that type of thing? Everywhere.
Honestly, kind of like all over the place. I mean, I would say most commonly I'm utilizing that on people's like calves, the neck, the shoulders, you know what I mean? Forearms is a really good one. And I like doing that on my own forearms just
Mhm.
because it feels so good. Um, yeah, let's
And
see. I mean, I do
what's the therapeutic benefit of guasha?
of guasha,
Mhm.
it would be very similar to cupping. They're sister therapies. So essentially, when your skin is getting red from guasha or cupping, and that's like petechia. So we're breaking these very like superficial blood vessels. And I would have to say that it's like it's giving your body this signal to come and repair this area that it's like a little micro trauma. It's maybe being like perceived as a little bit of damage, but your body knows what to do with that. And it's going to send all these good, blood and lymphatic and all the warriors that need to come in and just repair it. So,
All the healing properties.
yeah.
I love it.
Pregnant
And
moms do ask me like if there's things that we need to avoid. And I would say like, other than putting pressure like directly on the abdomen, something which like we, common sense would probably tell us to not do in massage.
Mhm.
Um, or certain areas, right? We can get your iliacus and a little bit of
Mhm.
psoas, but not like, you know what I mean? I'm not
Not next to the vertebrae. Yeah.
right. So really, other than that, a couple hundred years ago, or maybe not even that long, but like, there was pioneer women out there doing the thing, or like, cave women out there doing the thing, and they were gonna what were they doing? They probably were not being treated like delicate flowers, you know what I mean? So I think that the body can handle quite a bit at that time. And I think it can handle the therapeutic work, which
Mm.
is, I don't know, that's what I'm here for.
That's perfect.
So
Cool.
not like I'm gonna beat the tar out of somebody, but you
No.
know what I mean? Yeah.
Definitely not.
No.
Well, thank you so much for being with us today, Sarah, and thank you for all of your therapeutic knowledge and information.
Thanks for having me.